Today we are going to discuss diagnosis of carcinoma of lung. Why this is important? Why we choose this topic for today's discussion? These are the certain questions need to be answered because CA lung, one of the most deadly cancer for the human society, because it is often diagnosed at a stage where definitive treatment, means surgical treatment, cannot be applied. Why it is late diagnosis? What things can be done to get early diagnosis, to get a proper definitive treatment for the CA lung? That's why early diagnosis of CA lung is important. If we diagnose CA lung at a later stage, means stage 3 or stage 4, definitive treatment is very difficult for the patient and for the clinician also. So today we will discuss about diagnosis of CA lung. The early diagnosis of carcinoma lung is important, as I told you, because delay in the diagnosis lead to only palliative treatment of it. Late diagnosis of CA lung deprive the patient from curative treatment, hence shorten the lifespan. Why CA lung diagnose? CA lung diagnose because of its natural history. All over the world, globally, more than 80% of lung cancer patients are the non-surgical candidate, means the surgery cannot be applied for the 80% of the diagnosis of CA lung. In India, this figure may be much higher. So certainly timely diagnosis of CA lung certainly save the huge lives. Now when to suspect? History is very important. Second is clinical examination. What is history? Because what happens in the respiratory system, all the disease, whether disease CA lung, whether disease tuberculosis, whether disease pneumonia, whether it is something else, ILD, whether it is something else, there are certain common symptoms. Those symptoms are non-specific. Symptoms are cough, hemoptysis, chest pain, weight loss. But there is certain difference, very thin line difference, that we need to understand about CA lung. Thus we come to the cough. Cough is the earliest symptom. Cough is the earliest symptom of the CA lung. What happens? Cough, because smoking is contribute to CA lung very much. So what happens? Patient as well as clinician take it as granted that it is due to smoking. It is due to smoking. So patient also ignore, clinician also ignore. Take certain history, whether there is change in the cough, nature of the cough, whether there is a change in the voice along the cough, whether cough needing some change in the treatment. So cough is one of the most common and earliest symptom. Second is hemoptysis. Hemoptysis is very important symptom, because it is the hemoptysis which led to the patient as well as clinician. There is something is unusual, because human tendency is when he saw blood, he rushed to the doctor. So hemoptysis is one of the important symptom. What is the problem? Hemoptysis occurs in a number of diseases. it occur in CA lung, it has occur in tuberculosis, it occur in pneumonia, it occur in bronchiectasis. Almost all the respiratory disease having a symptom of hemoptysis. What is specific for CA lung? CA lung is whenever we should also encounter the question, what was the amount of hemoptysis? The hemoptysis of carcinoma lung usually scanty. Whenever patient said that I have hemoptysis 2 months back, it was little in amount, and patient take it very casually. But for clinician, it is very important. Scanty hemoptysis should alert us to get investigation. So scanty hemoptysis more favor to what? Malignancy, while large hemoptysis is more favor to what? Non-malignant disease. One is chest pain. Another symptom is chest pain. Chest pain is very common symptom for all the diseases. What about CA lung? CA lung is very specific. Dull-aching chest pain. Patient usually don't care about that amount of chest pain. Patient take it ignorant, whether it is due to trauma, whether it is due to something eating habit. Patient take it granted. It is maybe due to some eating habit, maybe due to somewhere else he has fall down. Patient correlate with this pain with that scenario. But whenever it is a dull-aching chest pain, clinician should alert. Sharp pain usually uncommon in the carcinoma lung until unless there is an involvement of pleura. Another is weight loss. Unexplained weight loss. Should alert the diagnosis, should alert the clinician for the investigating patient for the carcinoma lung. The symptoms are very non-specific. But there is thin line difference between symptom of carcinoma lung or symptom of other diseases. This all I have discussed. There is also breathlessness. Breathlessness usually patient of CA lung usually are smokers. They correlate their breathlessness contributing due to the smoking. But there is an unexplained increase in the breathlessness, so we should alert for the making of investigating patient for the carcinoma of lung. Now certain thoracic metastatic manifestation. What are those? There is supravenaga syndrome, phrenic nerve palsy, recurrent nerve palsy, Panco syndrome, cardiac involvement esophagus. All are some specific signs and symptoms. Supravenaga, there is a difference in edema. Phrenic nerve palsy, there is a increased dyspnea in the lying down position. Recurrent nerve palsy, there is a change in the voice. Panco syndrome, anhidrosis, meiosis, anhidrosis, and chest pain, and cardiac involvement and involvement of esophagus leading to the dysphagia. Now we come to the extrathoracic manifestation. CA lung can match the every part of body. Commonly involved organ are brain, bone, adrenals, liver, and certain endocrine manifestation which is known as paraneoplastic syndrome. Now we come to the radiology. What is on radiology? Though we can doubt that this percentage of a CA lung, that this patient should be workup for the CA lung. There are certain features in the radiology. Earliest, most ignored symptom is volume loss. One is collapse. One is massive fluid diffusion. One is recurrent fluid diffusion. There is apparent mass. Specific radiologic signs, certain like golden signs. Irregular cavity at typical site. Usually benign cavity are smooth and the dependent part. So cavity is non-dependent part. Nodules with the spiculated margins and bone erosions. Now we can see that there is a volume loss on the left side. There is a this patient was ultimately diagnosed with the carcinoma of left lung. There is a bronchoscopy done, and you can very well appreciate there is a volume loss on the left side. This is again collapsed right lung. We can see trachea septate to our same side. Right hemithorax is opaque. This patient was also diagnosed with CLM. This is a complete collapse of right lung. Again, this is a collapse with effusion. This is a complete right hemithorax. This patient is trachea septate towards same side. There is a CP angle blunting. There is a complete right hemithorax is completely opaque. This patient was also diagnosed by the bronchoscopy as a CLM. There are certain radiological signs you can visible. Thank you.